Artificial Intelligence Doctor. User question. How and why right lateral decubitus positioning stops a leadless pacemaker? Claude AI answer. How and why right lateral decubitus positioning might affect leadless pacemaker function. Right lateral decubitus positioning, lying on the right side, doesn't typically completely stop a leadless pacemaker, but it may interfere with optimal function through several physiological and mechanical mechanisms. Mechanical effects. Direct pressure effects. When a patient lies on their right side, the heart shifts toward the right side of the thoracic cavity. This can increase the pressure between the right ventricular wall and the pacemaker device, particularly if the device is positioned on the free wall of the right ventricle rather than the septum. Altered contact angle. The pressure from right lateral positioning can change the angle at which the electrode contacts the myocardial tissue. For helix-based fixation systems like the Avere VR, this may cause subtle torquing of the helix within the tissue, changes to the effective contact surface area between electrode and viable myocardium, increased interstitial pressure. The right-sided positioning can increase interstitial fluid pressure in the right ventricular tissue surrounding the pacemaker, potentially affecting the electrical field distribution. Physiological effects. Regional myocardial perfusion changes. Right lateral positioning increases right ventricular afterload and can transiently decrease regional perfusion where the device is implanted. Reduced perfusion may increase local tissue impedance and excitation thresholds. Autonomic effects. Right-sided positioning can enhance vagal tone through baroreceptor mechanisms, which may reduce myocardial excitability, increase capture thresholds. These effects may be more pronounced during sleep when parasympathetic tone is already elevated. Respiratory interaction. Right lateral positioning changes diaphragmatic movement and intrathoracic pressure dynamics, which can affect right ventricular filling and pressure relationships around the implanted device. Clinical observations. While complete failure to capture is uncommon, the following have been observed. Threshold variations. Clinical experience has shown that some patients may experience 0.5-1.0 V increases in capture threshold in right lateral positions, particularly with leadless pacemakers that already show borderline or rising thresholds. Intermittent capture issues. Rather than complete cessation, more common is intermittent failure to capture, particularly during deeper sleep stages when positioned on the right side, where the combined effects of positioning and sleep-related autonomic changes may temporarily push thresholds above programmed output. Patient-specific anatomy. The effect varies considerably between patients based on exact device positioning within the right ventricle, cardiac chamber size and orientation, tissue characteristics at the implant site, presence of fibrosis or other tissue interface changes. Practical implications. For patients experiencing nocturnal capture issues with leadless pacemakers. Position testing. Consider testing capture thresholds in various positions, including right lateral decubitus, during follow-up evaluations. Higher safety margins. Program higher output settings, particularly for patients who prefer to sleep on their right side. Sleep position modification. In severe cases, recommend avoiding the right lateral sleep position or using supportive pillows to reduce the direct pressure effect. Implant site selection. For new implants, particularly in patients who habitually sleep on their right side, septal positioning may be preferable to free wall positioning to minimize these effects. While complete pacemaker stoppage due to positioning is rare, the combination of positioning effects with already elevated thresholds, as in your patient's case with a 3.0 V threshold, could potentially create intermittent capture failure, particularly during sleep when these effects are combined with autonomic changes.